Director of Education, Tony Stack, CEO and Director of Education of the Newfoundland and Labrador English School District, and Dr. Roseanne Sevier, Medical Consultant with the Department of Health and Community Service. Please stand by. Our event is ready to begin.
Well, good afternoon, everybody, and thank you for joining us. I am joined today by Tony Stack, the CEO and Director of Education with the Newfoundland and Labrador English School District, and Dr. Roseanne Sevier with the Department of Health and Community Services. We are here today to provide an update on the plan for resuming in-person classes. Ever since we announced the move to online learning for our K-12 system, we've been consistent in our message. Our priority is to return to in-person, in-class education when it is safe to do so. We know it's in the best interest of our province's students, our children. We have set a potential target date of Monday, January 24th, for the resumption of in-person classes. We've all heard yesterday's update from Dr. Rahman around modeling, so that certainly factors into our considerations. We will remain online next week. While I know that this is not perfect, it has allowed us to minimize learning loss during these difficult times. I thank all students, parents, guardians, and educators for working through these challenging times. And thanks to this, we continue to have less learning loss than other jurisdictions. We are trying to balance the concerns around Omicron with the very real concerns from medical professionals around keeping our children in school. In recent weeks, we've heard medical experts across the country, including the Canadian Pediatric Society, call for an end to online learning. Their message is stark: increased risk of depression and anxiety, as well as other social and mental health challenges. They have stated in a recent letter that deteriorating health and well-being of children and youth is also a public health emergency. Students belong in the classroom, where they can benefit from social interactions, face-to-face contact with educators, and where they have access to school resources, where they learn better. As the Premier had indicated yesterday, what we want is to avoid the disruption of continuously moving back and forth between in-class and online learning as a result of educators needing to isolate. To help alleviate this, we are working with the school districts, the NLTA, and the Dean of Education at Memorial and his faculty to maximize our availability of substitute staff when an educator needs to isolate. We are also adding another tool to the toolbox. We will be distributing rapid test kits to all students, educators, and staff in schools throughout the province. The test kits have already begun arriving in schools, and we expect them to reach all schools by the end of this week. As long as there is no substantial change to risk level, kits will be rolled out to families and staff once a date to return is finalized in advance of required testing. School administrators will provide information to parents and guardians on how to access their test kits. Everyone will receive 5 tests, which will be used for both the return to school and to deal with symptoms when schools are open. For A return to classes, students and staff will take 2 tests, one 72 hours before the first day of school and one the morning of the start to the school day. If both of your tests are negative, you can return to class. If you see a positive result in one of your tests, do not take another test. Follow the guidance for positive cases available on the COVID-19 website. Once schools are reopened, the remaining 3 tests will be used for symptomatic testing. Anyone exhibiting symptoms should stay home. Take a test for the first day of symptoms and again 72 hours later if the first test is negative. There is a guidance document laying out these details, and it will also be made available through PowerSchool and by email. The document has step-by-step instructions on the use of these tests. I'm now going to ask Dr. Sevier, who has joined us today to demonstrate for the benefit of everyone watching how to use these test kits. Dr. Sevier.
Good afternoon. Thanks for joining us here today. So I'm going to demonstrate to you how to do a self-test. And of course, if for parents of younger children, you would be doing this for your child, and then older children can do it themselves. So what are you going to get from school? You're going to get an instruction sheet, which looks like this. And that will come in your package. You will also get swabs, and this is the test kit. And then you will get a solution also that you will be using. It won't come with an egg cup. I brought this myself, but so you just need something that you're going to stand up your tube in. Anything will do. I chose an egg cup because I can't spill this, as you can see. So, and you can always rip one off from an egg carton, that piece. So I wanted to show you something before I started. I wanted to show you, this is the nasal swab that we're using, and the swab goes into your nose about 1.5 to 2 centimeters. So just to let you know, 1 to 2 centimeters. This swab itself is about 1.5, this part of it, so I'm gonna not use this one so I can handle it. So this is about 1.5 centimeters long. So for a smaller child, this is gonna, most of this is gonna go in, and then for us older crowd, we're gonna go beyond that soft swab piece. So first thing you need to do is wash your hands, or I'm just going to sanitize my hands here, so, which we're all very used to doing. And then what I'm going to do, I'm going to open this, which is my swab, and I'm going to open it without touching it. And I'm now going to, so I have my little tube of solution sitting in my egg cup. I'm going to open this swab, and then I am going to stick this in both my nose. I'm going to tell you what I'm going to do first, because I don't think I'm going to be able to talk when it's up my nose, because it does bring tears to your eyes. So I'm going to hold it about in the middle, and I'm going to put that whole a soft, sort of spongy swab up my nose and go just beyond it. So if you're older and you want to do that in a mirror, so you're making sure you get it all up there, that's good too. So I'm going to sample from both my nostrils. So I'm going to turn it 5 times in one nostril and against the sides of my nose, and I'm going to then do the other nostril. When it's done, I'm then going to put it in the solution. So here goes. So 1, 2. Okay, that's done. All right, so then we're going to open the test tube, take off the cap, and we're going to put this in. I'm going to put that back in there so I don't spill it. And then I'm going to use my iPhone or any kind of a timer on your watch, and you're going to time for 1 minute. Sorry, you're going to, first of all, you're going to swish it around. Forgot that. So you're going to 3 or 4 times swish it around. That's why you follow the instructions closely. You're going to 3 or 4 times push it against the bottom, and you're going to swish it around just to make sure you're getting it nice and squished. And then you're going to leave it. And when we take it out, there's a few seconds left. Okay. We're now going to really press this against the side so that we're getting all the fluid out of that softer swab. So we're going to press that against the sides. Then we're going to take that out and we're going to dispose of this swab. I'm going to put this back in here. And now I'm going to open the test kit. And you can see that the way I'm opening the test kit, and this is all in the instructions, there's an arrow showing me where to open it. And this allows me not to contaminate the part of the test strip that I don't want to be touching with my hands. So we're going to take the test strip out. This is what the test strip looks like. And then I'm going to put the test strip in my tube. At this time, then, I would now time for 10 minutes. So once again, using my stop clock, my watch, timer, whatever you want to use, you're going to put it on 10 minutes. And you need to leave it in there for 10 minutes before you read it. Make sure when you're doing this, you have the time to do all this, because also when the 10 minutes is up, you want to read it fairly quickly. You don't want to be leaving it any longer than 5 minutes. So I'm not going to make you sit here for 10 minutes. What I've done is I did my test this morning before I came in. So this is the second one I've done today. And just to show you, this is what it looks like. So the pink is a positive. So here, when I've had a negative test, and I'll show you, they're trying their best here for me to, there's one blue line. I'll actually show you on this diagram because it's easier to see. And so you just have one line, and this is all in your instructions. It's drawn, it's shown. And then I faked a positive one by putting with a pen for you guys, just to show you what a positive test looks like. It's got a blue line and a pink line. So just to show you, I think that's not so easy to see, what it looks like here. Is that when it's positive, you see that's the blue control line. And then when you see the pink, that's positive. So you always need to see a control line. That means the test is working well. And then pink is positive. And it shows you here, they just show 3 examples that pink line may show up very strongly, or it might be even a little milder. And once again, all those instructions are here on the sheet you will receive with your kits that comes with your set. So what does a negative result look like? The one that I did this morning that I tried to show you, but it's kind of tiny. I'll show you on this because it's a lot more easy to see. And this is here, what you'll see is that if it's negative, you're getting just the blue line, just the control line that's telling you the test is operating, and you're not getting any pink line. Sometimes a test can be invalid. How do you know that? Well, what happens with an invalid test is you're not getting that important blue control line. You may get a pink, or you may get nothing at all, but you should always get the blue control line, tells you the test is working, and then the pink is a positive result. So in this one, we consider this invalid. What do you do if you get an invalid result? Well, we have asked you to do 2 before entry, 2 when you if you have symptoms, and there's a 3rd test in your kit because you're getting 5, and that can be used when you have an invalid result. So I think that's all I wanted to tell you, and no worries because you will get your handy instruction sheet. So I would recommend that you read it up front and then read it as you go along, and you'll do fine. And then what you need to do is everything can go into the garbage, so you can throw things out and then just clean your surface when you're done. So thanks.
Well, thank you, Dr. Sevier. And in addition to the instructions that you'll get with your kit and emailed through PowerSchool, we will take a clip of Dr. Sevier's presentation today and make that available so that you have not only the written instructions, but the video to refer to once you get your test kits. In closing, let me say this: pandemics are unpredictable. We have a solid plan here, and we have room to evaluate changing circumstances. We will continue to evaluate those circumstances. and we will confirm the date for resumption of in-class instruction next week, provided it is safe to do so. Again, to our students, I hope to see you back in school soon. To our teachers, thank you for your continued dedication. While I've seen many examples of creativity during online learning, I know most of you prefer to be back in the classroom with your students as well. I want to thank Mr. Stack and Dr. Sevier for joining us here today. And with that, all three are available for questions from the media. Thank you.
Thank you, Minister. For the benefit of our speakers, there are 4 reporters registered for today's announcements. The question and answer session will be conducted in one round, where each reporter will have the opportunity to ask 1 question and 1 follow-up question. There will then be a final round of a single question each. I ask each reporter to address who you would like to respond to the question. Our first questions are from Michael Connors, Vent TV. Please go ahead.
Thank you. Minister, this province is returning a bit slower than other provinces. Most are returning on Monday. I guess, what specific metric are you looking for on Wednesday to actually make the decision on returning to class? Today we had more recoveries than new cases. Are you looking for continuation of that? And why are you taking this more cautious approach than other provinces?
Thank you, Michael. I'm not sure if most provinces are resuming in class on Monday. I know we've done a jurisdictional scan, and I'm not sure that to be the case. But you are correct. We look at a number of factors, including the number of cases, but we rely on public health to provide us with guidance in terms of return to school. We weigh all risks, as do public health, through that guidance. And one of the factors is certainly the number of cases, but we may in fact return to school with a higher case count than what we've seen in previous times. What I can say is that this province, through the work of the Department of Education, our school districts in consultation with public health, have had less learning loss time than most jurisdictions. And I think our students have done well in this province. While online is not ideal, it is part of the reason we are focused and our attention is to getting back to in-class learning.
And if a child does test positive, will there still be, and they have to isolate, will there still be some sort of online learning option for them, or do they simply miss school now and they just have to miss class?
I'll pass that to Mr. Stack to answer. There is a continuance of learning model, but Mr. Stack can elaborate on that.
Yeah, thanks, Michael. Just like in any case where we have a student that may be out of school, could be broken leg, we would have a continuity of learning protocol in place where the school teacher would reach out to the family member and ensure that there is some sort of a learning plan for the child. It won't be the same as what is offered now in terms of virtual, but it will be enough substance to it so that the child does not fall behind.
Thank you, Tony. Our next questions are from Richard Duggan of VOCM. Please go ahead.
Thank you. If the return date is confirmed next Wednesday and the first test would have to be taken on Friday, that only gives about 2 days for all the test kits to be distributed to families and teachers. How does the department plan to get all those tests distributed in such a short period of time, and are there any contingency plans in place to avoid potential bottlenecks?
So I think I can take that, Minister. So if it's confirmed that the reopening is for the 24th, then Wednesday we will start the distribution of kits to families. And Wednesday and Thursday, that can occur. Each school is different. Each of our 254 odd locations have different populations and different geography. There may be something where the school schedules by alphabet. People come to the school and retrieve their kit, or it could be by grade level. The principals of the schools are in the best position to judge how that will unfold. We will also track those who do not retrieve the kits and work out some sort of a plan for them to retrieve those. That could be something along the lines of using normal bus routes and our transportation system to ensure that the kits are distributed. But we would really encourage, once this happens, for parents that can and families that can to arrange for pickup at the school location.
And so each student and teacher will get 5 kits to start out. As a parent myself, I know that there's lots of runny noses and there can be quite a number of symptoms over the course of several weeks. If someone runs out after the 5, will they have access to more rapid kits if needed?
Thank you, and that is a good question. We will be working with, and we've had discussions with public health already. We are already planning for an additional distribution of test kits at a point in the future. 40% of the test kit will be used prior to a student returning to school. The 2 of the 5 tests, which would leave them with 3, barring if they get an invalid result, they'll use an additional. But that would give either 2 or 3 tests if you're symptomatic. Through the school, through the school districts, other test kits will be provided when they're needed, and the planning for that has already started.
Thank you, Minister. Next, we have Mark Quinn of CBC. Please go ahead.
Yes, my question is for the Minister. There's a lot of COVID around, and of course we all acknowledge now that Omicron is much more contagious. Are we expecting that once kids go back to class, we will see a lot more cases, just because there'll be a lot more people in contact with each other, and there are a lot more cases around?
Thank you for that question. Again, an important question, and I think it's important here because pandemics can evolve, they can change, situations can evolve. The plans through the department, our school districts, again in consultation with public health, continue to be fluid based on what's happening around us. Part of the reason public health have said schools should be closed is because, to lower the burden on our healthcare system. There's some 75,000 people within our school communities throughout the province. And because of the large population of our school community, based on the overall population of about 520, it was a very balanced decision to have schools resort to online learning. So more specifically, can we expect an increase in cases? It's quite likely. We are working with our school districts. We've had discussions with the NLTA. I want to put a big shout out to our Dean of Education and the Faculty of Education. We've been working with them to ensure that where we see vacancies as a result of isolation within our educators, the community of educators throughout the province, that we will be able to respond to the greatest degree possible and fill those vacancies so that we're not seeing the disruption of online today. We're back to in-class, and then we go back to online and back to in-class. It's something we're trying to reduce to the greatest degree possible. I'm under no illusion that we won't see some classes back on of qualified educators to fill those gaps, including working with the NLTA and our Teachers' Pension Plan sponsor body to ensure that we increase the pool of substitute teachers to help with this as well.
Thank you. And my follow-up, I believe perhaps the Minister can answer this one as well, but if not, if someone else can, that's fine as well. The tests that are being done, the rapid tests that are being done 72 hours before school, will there be any means of verifying those tests? Will people be expected to bring their results and some sort of evidence of the results of their tests on that first day of school?
I'll provide some answer to that, and I'll ask Dr. Sevier as well to add to that. But the I think it's fair to say with over 90% of our eligible population that is fully vaccinated. We have our students that are ages 5 to 12, over 70% with first vaccination. There's been a very solid uptake throughout the province on getting the booster shots. So people in this province, by and large, are doing the right thing. They are responsible, and they're helping protect not only themselves but other people in the province. So I believe that we will have solid uptake in terms of families, guardians, and children, ensuring that our school community, as well as educators and staff, very solid uptake on utilizing these rapid tests. We can't possibly police or monitor every household in the province. So, that's the reason we're providing the instructions. That's the reason we're going to make the video of the demonstration by Dr. Sevier available in terms of ensuring that the test results are being looked at appropriately. Dr. Sevier, can you add to that?
Yeah, I'm in full agreement, and we won't be asking people to show their tests, and I think people have shown that they really want to do everything possible to get kids back to school and to also decrease transmission in this province. And this testing is another layer that we're adding to all the other things that we're doing in the province to decrease transmission of COVID-19.
Thank you, Dr. Sevier. Next, we have Peter Jackson with the Telegram. Please go ahead.
Good afternoon. Perhaps Dr. Sevier could answer this. Why, back in eons ago when there was no COVID, kids who were sick should have stayed home anyway. So I'm wondering, what kind of symptoms are you talking about when you suggest that a kid go to school but test first?
So really, there's a couple of aspects to that, Peter. It's a good question. One is that we know a lot of times people with, kids with mild symptoms, parents think it's probably nothing, it's probably not Omicron, or it's probably not COVID, and they don't get tested. And another thing is, it's not easy when you've got a slew of kids. I had a slew once; they're all big now and not so bothersome. But to get to a testing center, get them tested. So we're trying to make this as sort of a layer of protection. We're trying to make it as accessible as possible, as easy as possible, trying to make it easier to live with a COVID that is so disruptive to our lives. So in this way, a parent can see, if their child has mild symptoms, that they can test them and then test them again in 72 hours. And then we ask them that if they have a fever, obviously you shouldn't go to school. I think we haven't changed that, and as you say, we wouldn't say send your child to school with a fever, but if the symptoms have resolved and they're getting better over the last 24 hours, then you can send your child to school. So some of that is also to mitigate against those lost days from other things that go around, and to do our best to support parents and families in staying in school while trying to cope with COVID-19.
Thank you. The other question I have is, I'm curious if you, Minister, or Public Health has set some kind of a threshold for switching gears on this. Is there certain, for example, a percentage of absenteeism that would make you rethink the whole plan?
Thank you. There's a number of factors, and again, we may see a higher case count provincially and see schools resume than what we've seen previously. So, there's no defined benchmark. This is done in consultation with Public Health, with our school districts, the English district and the Francophone district, and professionals within the department. We will look at the situation as it evolves, and through dialogue with Public Health, make a decision that is in the best interest of not only our school communities, but the safe operation of our health professionals and our hospital systems in the province. It was one of the reasons, again, when you look at the school community is, almost 75,000 people in the province. We've got a total population of 520,000. One of the reasons schools closed because of the fast nature of the spread of the Omicron virus, so as to not overburden the healthcare system. And for the safety, obviously, of students and staff within the school system. So there's no defined benchmark. It is based on how things evolve. It is based on consultation with public health. And we did see the news availability yesterday, and Dr. Rahman and Dr. Fitzgerald had talked about how this variant is different than previous variants and how the situation can sometimes evolve.
Thank you, Minister. I'll now ask each reporter if you have a follow-up question. Michael Connors of NTV.
Hi, so I guess I'm just wondering, is this all based on the honor system? Like if you get, you have a positive test, are you obligated to tell the school about it so that the other students in the cohort or the class know if they also need to get tested? And also just what do you do with the test when you're done with it? Do you just throw it out?
So right now, very similar to what parents did with respect to the daily screening questionnaire. We had, fantastic cooperation from families. So this is one other layer that we're adding. So no, parents will have to verify the test themselves before sending a child to school. Any aspect of contact tracing or communications that follow from that will be something that we'll follow the public health guidance on. So whatever the contact tracing protocols are for public health, we will adhere to those. So this is something that would occur in the home. The parent would utilize the kit. The child would remain home if there was a positive indicator. And again, it's not unlike the daily screening questionnaire. It's just one more tool in the toolbox that allows us to stay safe at the school level.
I'm going to ask.
Thank you, Tony.
Yeah, I'll ask
go ahead,
Dr.
Minister.
Yes, sorry. I'll ask Dr. Sevier to respond to this as well, and then I'll have a comment to make. But I think Dr. Sevier had indicated as well how to dispose of the kit, and just for greater clarification, Dr. Sevier.
So sure. So once you're done the testing, you can throw the swab and the solution. You put the top back on the solution and throw it in the regular garbage and clean the surface where you've been doing your test.
Thank you, Dr. Sevier. And I'll add again. I don't think we need to convince people in this province to do the right thing. With the very high vaccination rate, we are leading the country with juvenile vaccinations for our students between the ages of 5 and 12. We are leading the country. The leadership by our Premier, by the Minister of Health, by Public Health and Dr. Fitzgerald, their advice and their guidance, and a great deal of credit has to go to the general public in this province who followed that advice and that guidance. We have done much better in this province based on the leadership, the guidance, the advice, and the willingness and participation of the people of Newfoundland and Labrador to follow the guidance and advice. So I think they will do the right thing with these rapid test kits. They've done the right thing with vaccinations. They've done the right thing with other guidelines and the advice, and they've done the right thing in terms of the boosters. We've seen very, very solid uptake in terms of the boosters, and that is part of the reason this province has continuously done better than other jurisdictions.
Thank you, Minister. Next, we have Richard Duggan, VOCM. Do you have a follow-up question?
Yes, thank you. Minister, I understand that prior to this being announced today, you met with the teachers' union and other groups to discuss the plan. I'm just curious, how did they respond to this plan?
Thank you. And yes, the Premier did put together the group of union leaders from NAPE, from CUPE, and from the NLTA, put out the call to have these groups come together today. We also saw both school districts, the Department of Health and the Department of Education as part of that call. We talked about, the plan. We took feedback from the various groups. Some of that feedback we'll continue to have further discussions on. But by and large, I know the NLTA, for example, have indicated they would prefer to be back in the classroom than online learning, provided it is safe to do so. It's the same message that we've given from the Department of Education and from Public Health. So I think, that the desire to see our students throughout the province where they are best, and that is in the classroom, where they can learn better, they can socialize better, they have face-to-face interaction with their educators. It's better for their social, emotional, and mental health. I think we're all working towards that goal.
Thank you, Minister. Next, we have Mark Quinn, CBC. Do you have a follow-up question?
I do, thank you. Will parents be notified if their child's classmate tests positive?
So that's something that Public Health and the team is looking at, about how it's going to look at the moment. In the instructions that that are given, if you positive, you're considered a positive case, and the instructions in there are how you get information. How we contact trace has changed in the province, and how that's going to apply to schools. We're also looking at all across the country. Jurisdictions are looking at this and sort of changing how they approach schools, and we're in the process of looking at what's happening elsewhere, looking at speaking to our own modeling team, and looking at how we best deal with contact tracing in a school setting.
Thank you, Dr. Sevier. Our final question is from Peter Jackson with the Telegram. Do you have a final question, Peter?
Yeah, with regards to waiting until Monday after this one, is the hospitalization rate going to influence any decision as to whether it's going to go ahead? Because I know that's a major metric that the province is looking at.
Thank you, Peter, for that question. That is certainly one of the factors. I think you look at the overall rate of infection, you look at the hospitalization rate, you look at the rate of spread, you look at other risk factors when you make any of these decisions. As I said, the decision to go to online learning was not taken lightly because we know the other implications that it has on students, on their learning, and on their mental and social well-being. So those decisions were not made lightly. It's based on guidance from Public Health. And I've said throughout this pandemic that I have trusted and followed the guidance of Public Health. We don't always fully understand because, the vast majority of people in the province, quite simply, are not epidemiologists. Or don't understand how you follow and monitor infectious disease or public health, but we follow the guidance, and it has always led us in the right direction. We'll continue to follow that guidance.
Thank you, Minister. I'd like to thank everyone for joining us today. Minister, do you have any final remarks?
Thank you. Just wanted to thank all of the media who've joined us today to help get the message out and for your questions, very solid questions. Wanted to thank those who viewed, are tuned in today. But a special thank you to our school communities, our educators and staff in the school communities who've had quite frankly, 3 years of adapting and moving with change. Everybody has performed exceptionally well. We've done well in this province, and a thank you to the general public who continue to follow public health guidelines. As I said, sometimes not always understanding those guidelines, but the fact that we followed those guidelines. We all have COVID fatigue. We are all anxious to see this pandemic behind us, but I think it's very important to continue to listen to the guidance and advice of public health because it has led us in the right direction throughout this pandemic. Thank you to everybody.
Thank you, Minister. Tony, do you have any final remarks?
Yeah, thank you. And again, thanks for the media for attending. Once again, we're asking our school communities to do something a little different and step up. I have every confidence that they'll do so again. We've had great support from our administrators and our teachers and teaching and learning assistants and all the staff that support them, as well as our families. Just thank you and looking forward to your cooperation.
Thank you, Tony. Dr. Sevier, do you have any final remarks?
Just want to thank everybody for coming and for watching that demonstration of me stick a swab up my nose. And I wish everybody the best as school opens. We know this is where our kids need to be. This is what our pediatric colleagues tell us, tells public health, and this is what many parents are telling us. So I think that with the way the Department of Education is moving and the layers they've built into the school system, that we hope for a very successful return to school.
Thank you, Dr. Sevier. Our time has ended, and I ask everyone take care and enjoy the rest of your day. Stay safe.